if anybody knocks, just let them be. I've got a sign out there that says, "Go away, we're speaking," or something like that. It's a little nice. It's worded just a little nicer than that, but.
I've been really sick, so my voice is kind of like, I apologize.
And I think, Galen, maybe I've got you kind of dead square in the middle of your presentation screen. So if you want to just pull, just roll the table a foot or two that way, that'll help. That's good. And anytime you're ready, go, Kitty.
Okay. So according to the Clean Water for the World,
Sure.
Yeah. According to the Clean Water for the World Fund, every 15 seconds a child dies from waterborne diseases. That's 5,700 children per day because they have no access to clean water. When I worked for nonprofit housing, we donated a percentage of our checks to any charity we wanted to choose, and I decided to look into the different charities and see what my money was doing, and I found that most of them were for cancer research and stuff that had a lot of money put in but didn't show much results. So I started looking at charities that provided food to third world countries, and I came across a Clean Water for the World Fund. I don't know how it works, but and I found that you could give a small amount of money and actually save people's lives. Nearly 1 billion people suffer because they have no access to clean water. Most of the problem is in the third world and developing nations. And according to the Water Project, over half of the developing world primary schools have no access to clean water. Waterborne pathogens cause crippling, painful, and deadly diseases. According to the CDC, it's parasites from fecal matter are the most common, and the most common disease is dysentery, which according to Merriam-Webster's is extreme chronic bloody diarrhea that kills through dehydration. Also, pollutants such as heavy metals like lead can stay in the body forever and cause acute organ failure. According to the UN, half of the hospital beds in the world are occupied by those suffering from waterborne disease associated with a lack of access to sanitation. 88% of global dysentery is attributed to unsafe water and inadequate sanitation. According to the World Health Organization, it's estimated that in the 1980s, a child died every 6 seconds from diarrhea. Dysentery from contaminated water kills 1.5 million children per year, which is more than malaria, AIDS, and measles combined. Water gathering is a primary responsibility of women and children, and it's estimated that they spend over 200 million hours a day collecting water that is then unsafe for them to even drink. So besides, how does this affect you? Besides just the pain of knowing about other people's suffering, you want your money to actually be doing something, and most cancer research and other research for other disease charities, they take massive amounts of money and they have yet to cure any of these things, when you could give $5 is enough for 200 days of clean water for a school or for a family. And for less than the cost of drinking bottled water, opposed to just your tap water, You could provide clean water for entire villages indefinitely and save the lives of thousands of children by donating to one of several clean water funds. Before. The clean water funds, they use your money to directly fund the drilling of wells, the creation of sand dams that help prevent runoff pollution, the building of rainwater collection sites, improved hygiene and sanitation to stop pollution of groundwater, and the protection of spring water supplies. This is the drilling of a new well, and that was the water before the new well and after. One example of how the money was used in Typhoon Yolanda in the Philippines, the donations to UNICEF, they airlifted water purification tablets and filtration systems, and they saved almost 200,000 people. According to water.org, the newest estimates for right now, the rate of children dying has slowed from every 15 seconds to every 21 seconds. And this slight change means that the donations have helped save over 1,656 children per day. The first objection to donate to this is that research for cancer and other things is more relevant to us in the first world. And my answer to that is that that's selfish, I think, and it's silly to think that we're not all interconnected and that, that their suffering doesn't have anything to do with us. The second objection is, where does this money go? And with these clean water funds, they will send you photographs and reports of exactly what your money is doing, and they'll even accept you to go there and help and see what your money is doing. And you to visualize if we don't donate, if we don't help, then the death tolls will continue to rise, and these countries will be destabilized, and this will lead to political unrest, which will negatively affect all nations. If we do donate and help, we can eliminate the needless deaths created by no access to clean water. We'll have stronger nations with which to do business. So we've seen how many charities can take large amounts of donations and show little results. Many people in the world get sick and die from something as simple as not having clean water. You could give a small amount of money to do a large amount of good. And you should want to save people the agonizing death of waterborne diseases. We take for granted something as simple as having clean water. And I'd like you to pledge or place some money in an envelope that I'll pass around, and I'll email you the websites of several places to donate your money. And while I've been talking, over 30 children have died in the world from waterborne disease, and I think we can easily stop this from happening. Thank you.